Welcome to CIHT Podcasts.
Welcome to the CIHT Podcast. To enable key workers walk or cycle more safely, barriers to imposing car-free streets have been lifted. The organisations behind the call to government to do this include Barts NHS Trust, British Cycling, Sustrans, Brompton Cycles, the Ramblers and Cycling UK. I'm joined by Roger Geffen, the Policy Director at Cycling UK today. So why did your organisation decide there was a need for this action from government?
In these extraordinary change times, there are a lot of people who are taking up cycling for a variety of reasons. Some are doing so, to be able to get that bout of daily exercise that the government has rightly recommended that people should be taking to get out of doors, and indeed to do that with families. That's really important. For other people, it's key workers who are still needing to make those key journeys to the hospital to provide care or whatever, without relying on public transport. And they too have been taking up cycling. So we thought, there is a clear opportunity to make conditions safe for them to take up cycling, and indeed to make it easier to walk, for pedestrians who are often walking on quite narrow pavements, to be able to socially distance. They need to be able to walk in the road. When they start walking in the road, cyclists need to veer further out into the road to avoid them. And although the streets are quieter, some drivers are taking the opportunity to drive faster. So we thought there were a whole load of road safety reasons why we just needed to make it easier to walk and cycle using road space that is now currently underused. And of course, the interesting bit is, by freeing up that road space for people to take up cycling, how much more demand for cycling is going to be realised? And is this potentially then not just something that to be done in response to the emergency, but as part of the wider changes that would help us be resilient for the bigger, longer term emergency of tackling climate change as well as coronavirus?
And could you briefly explain what government has changed with the process that they instruct full road closures?
The government has made a small but very helpful change, which isn't actually directly related to our request. What they've done is it's actually something they were thinking about doing anyway. They've said, for local authorities who are thinking about making these sort of temporary changes or changes using temporary infrastructure, we know that the government recognises there is a difficulty for local authorities because of the requirements to publish temporary or experimental traffic orders, indeed any traffic order, traffic regulation order, traffic management order, in a newspaper circulating in the local area. That's what the legislation requires. The trouble is, quite a lot of areas now no longer have a newspaper circulating. Newspapers have gone online. So the government's guidance is, if there isn't a newspaper circulating, it is reasonable to just publish online rather than in an online newspaper, rather than fulfil the letter of the law. But they've said that they've done this in response to the calls for local authorities to be able to provide temporary infrastructure. So by saying that that's what it relates to, they are basically encouraging local authorities to think about temporary infrastructure, which, as far as we're concerned, is helpful. And
could you explain what temporary infrastructure to support cycling is?
It can be a variety of things, and it might not just support cycling. It may support walking as well. This is exactly why our joint letter was signed with Living Streets and the Ramblers, as well as Sustrans, British Cycling, Bicycle Association and Brompton, with Barts NHS Trust also involved. I should have mentioned the London Cycling Campaign were also signed. It can be widened pavements, particularly where the pavements are narrow and or where pedestrians are having to walk past queues of people outside shops or outside shops, and therefore where it's difficult to do for the pedestrians themselves to do the social distancing. It can be filtering out through traffic. It can be putting effectively a planter as a temporary road closure, for instance, to create a temporary low traffic neighbourhood to cut out the rat running. And here too, there is an opportunity to see these opportunities to create better walking and cycling spaces in local areas, not just as a temporary measure, but as possibly an experimental measure to test out whether there is demand for it in the longer term. Likewise, there are opportunities to put in cycle lanes using what are known as traffic ones, i.e. little plastic bollards. These have been quite widely used to put in protected cycle lanes quickly and relatively inexpensively. The main reason why it's a cost saving compared with a proper curb segregated cycle facility isn't just that the materials are cheaper, it's because you don't have to realign the drainage. But if water can flow between these, between the bollards or the planters or whatever it is that creates this light segregated cycle lanes, then it's obviously a lot cheaper, and it can be done temporarily. And that means it can be done either in the short term or as an experiment, which may or may not be retained for the longer term, depending on whether people like it. Obviously, we are hopeful that by enabling a lot of key workers, particularly in the NHS, to use these facilities to get around by bike, reveal the pent-up demand for cycling, and that some of these temporary infrastructure measures will actually become permanent.
And there is a concern that due to highways work slowing and stopping in some cases, that the condition of the network that will emerge after social distancing measures have been lifted, that the condition will be much worse. Could you just explain a bit about the risk with poor road maintenance and cycling safety, and also touch on maybe what can be done when major works are undertaken to kind of support cycling going forward?
Well, absolutely. Cyclists are disproportionately affected by poor maintenance, so are pedestrians. For drivers, obviously, a pothole can, do damage to the axle of the motor vehicle, and that is a bit major concern for motorists. But for cyclists, it's much more serious. We know that cyclists, the average maintenance-related damage claim from a cyclist is 13 times higher than for motorists, because it's much more likely to involve personal injury. In the last 10 years for which we had data, poor maintenance was a factor in I think 22 cyclists' deaths. So it can cause very serious injuries and some deaths. So it's not just a matter of property damage. We absolutely agree with the local authorities and indeed with the government that we should get away from simply patching up the potholes. Planned highway maintenance, i.e. resurfacing the whole of the road surface before it starts to get potholed, is actually far more cost effective. It just requires local authorities to have enough upfront cash to do it, and a lot of them are really struggling with that. But when they're doing this planned road surfacing, one of the opportunities is to put in some of these measures like planters or traffic ones to create a cycle facility or a road closure to motor vehicles while they're at it. That effectively gets two jobs done for the price of just a little. I was going to say two jobs done for the price of one. Two jobs done for the price of very slightly more than one job. If local authorities are encouraged to think about aligning their cycle programs, where do they want to put in cycle facilities, where are they trying to do and highway maintenance, can they do two things for the price of just more than one?
It's interesting you mentioned about footways as well. I know that in New Zealand, to prepare for Covid-19, they'd actually look to increase the widths of the footpaths to allow for distancing for people. And I think we are seeing road closures across the globe. There's been similar things happening in New Zealand, Canada, and the US. So,
likewise, Berlin and now in Milan. So yes, and the first example has now appeared in Brighton. The first UK example has now appeared in Brighton.
That's where it started off in the UK, in Brighton. Could you just explain what they did there briefly, and then we can then maybe give some thoughts to what kind of transport might emerge when we emerge from the current crisis?
Well, the Brighton example is in fact the road part of the road along the seafront, Madeira Drive. So that is a very obvious place where people are going to want to go out for that bit of daily exercise, just in a nice space where there's really good clean air and all those sort of things. We would certainly encourage local authorities to think about the places where they choose to do this. Go for places where it is likely to be well used and popular. That includes places like, well, not just seafronts. Not most local authorities haven't got a seafront, but they may have a riverside, but also the routes to where key workers are going. So the route to the hospital, or indeed the route to the local park, not just in the park. What about the route to the park so that parents and their children can get there in safe conditions? So, in other words, think about, or indeed, as we start to approach the possibility of schools reopening, start thinking about the route to the school so that the children can get there without a revival of the car traffic, and giving them that opportunity for healthy travel.
And Cycling UK has recently launched a toolkit about what local authorities can do to implement these faster processes for putting in car-free streets. Could you just explain what's in the toolkit?
It's an information briefing that sets out, firstly, the reasons why local authorities may want to do this, the range of things they can do, as we've talked about already, whether it's the widening of the pavement, the closure of local streets to create lower traffic neighbourhoods, or the cycle lanes using temporary infrastructure. It talks about the reasons you might want to do that. It talks about also how you might do this in legal terms, using either temporary traffic orders or indeed temporary notices if you really feel it needs to be done absolutely straight away, or experimental traffic orders if you think that there is a reasonable chance that you might want to make it permanent afterwards. And that we've provided a bit of a steer on the processes for doing that, whether you're in London, where it's traffic management orders, or in England and Wales, traffic regulation orders, or the slight differences in the legal system in Scotland. So we've provided the kind of pointers to procedurally how local authorities can do this. And that is available on our website, cyclinguk.org. And I'm pretty sure it's fairly near the top of the campaigns page, but if you need to search for it, cyclinguk.org/campaigns should get you there.
And finally, you've encouraged NHS workers to get on their bikes. Could you just explain what Cycling UK has done?
Well, yes, absolutely. And incidentally, I should say this is also what led to the collaboration with Brompton on writing that joint letter to the Minister, to Chris Heaton Harris. Brompton have been giving away free bicycles to NHS staff. Meanwhile, we were giving away free memberships to NHS staff. So we realised we had a common interest with Brompton in collaborating on this whole thing of enabling the health workers to take up cycling. So yes, we've offered free memberships to NHS workers, and as of yesterday, we'd had 1,400 getting on for 1,500 people taking up that offer. We're then going to want to find out, so how many of these people were new to cycling or were only cycling occasionally beforehand? How has it changed things? How are they perceiving cycling? And what are they are they likely to carry on cycling? So this is going to potentially become a very interesting kind of route into people in the NHS, some of them discovering cycling as a new thing that they hadn't really thought about before, hopefully keeping going, and hopefully in the cases of those who are working with patients, with GPs and so on, recommending cycling to their own patients. That, in other words, this could have a very big knock-on ripple effect.
And Bart's NHS Trust also were one of the signatories. So briefly, that alludes to the health benefits of cycling. If you were selling cycling in a few words, what would you say are the health benefits of cycling?
There's very good evidence for that cycling reduces your risk of various cancers, of inactivity, of all the inactivity-related illnesses, obesity, diabetes, stroke. It helps manage lung conditions. It has a huge range of health benefits. It reduces osteoporosis. It gives you increased life expectancy. On average, a person cycling regularly and in mid-adulthood can expect to have a level of fitness equivalent to being 10 years younger and 2 years of extra life expectancy. It has in fact been found that Cycling UK's own members have a life expectancy 2 years above the average. So join Cycling UK and get 2 extra life years on your life expectancy. Clearly, those benefits for the individual also help the NHS to save money. And of course, that adds to the fact that Cycling UK is beneficial in all sorts of other ways, reducing pollution. That, of course, improves the health, not just for the cyclists. So it's actually helping improve the health of all of us and creating safer streets, less congested streets, and helping to avert climate change. So in other words, cycling is the solution to an awful lot of different crises, to our congestion crisis, our air pollution crisis, our physical inactivity health crisis, and of course the climate crisis. It is an incredibly cost-effective solution to some of society's largest problems.
Great. Well, thank you very much for your time. That was Roger Geffen from Cycling UK.